Hey guys, on March 12th, my family started a strict stay at home policy. It was not easy, and it was not because the state required it. That was about a week and a half later. It was because of an article that I saw on Facebook, and it got me down a line of researching that confirmed a lot of what was in the article. It took me from the point of laughing at the pandemic to the point of understanding the science behind an outbreak and learning how to see decision making information out of what looks like very little information. And you see, when a virus comes out, it's easy to assume that nothing the experts have known applies because it's new, and that it'll take a long time to study it from scratch. But I gotta say that the coronavirus has existed in other strains for decades and has been studied, along with a number of other viral outbreaks that have gone around the world. And much is known about how these play out. So I just wanted to share my story of the information I've seen and how to use, what we know to get information that we didn't think was maybe available, to piece together what is knowable about COVID. This article builds up a number of facts and logic throughout the beginning, and the real middle or the heart of it is this chart here. This is the chart of COVID infections in a region. The bars are not totals because totals only go up. That's math humor. So they go up and down on these bars. These bars are the changes in totals. So these are the new people that day that were added to a total. So the orange bars are the people who asked for medical care on that day. They're like, hey, I feel less than well. So these are the people checking in. The orange bars are very visible. These are the numbers that you can see reported at the end of the day in a region. When these people came into care in this region, an interesting thing was done. The doctors interviewed every one of them and came up with what would be the day they contracted COVID. And they took those original days, and that would be the day that, that was acquired, or transferred to one person to another. And they took those days, and this would be the chart in green here of the actual days of when people were getting sick. The green chart is the one that we really want to know. This is the one that's real. This is what's happening. This is people are getting sick today, or that's more than yesterday, or something like that. And it's a bit not as known as the orange one, right? I mean, it's only known with a lot of hindsight. But the thing to point out here is when we do have hindsight, like a region that interviews people and gives us a nice chart, that it makes a specific shape. So I'm going to kind of zoom in on it here. So this is what we want to know. Because it's what's really happening, it makes a very clean shape. You can see the lines kind of being clean here, going up and down. The orange lines, have other factors that may be in play. It's not what really happened with the outbreak. And so it has a little bit of shakiness to it. Now, there is this one anomaly here with the green line. I would chalk that up to data collection anomaly. It's maybe someone said that, it was the beginning of the month that I got it from someone. And so they wrote down February 1st. But, other than that. Now, this shape of how an outbreak grows, stops, and turns around is not new. It's not surprising to experts that follow these things. It's been common for the COVID one around the world in other regions. It's been common in other outbreaks, or at least similar, very similar. So let's try to understand this shape a little more. The beginning of it starts off with the virus freely transmitting from people to people. And it's an exponential growth. So if you were to plot it out with detail, it would look like a chart out of a math textbook of exponential growth. When you get it scaled right, you start to see lines that look like a cliff, things that start out very slow. And when they really kick in, they're just shooting straight to the sky. So that's the beginning shape of this chart. It ends when you start enacting stay-at-home measures. So, or at least it starts to peak. The yellow dates here highlighted are the days that this region had stay at home, in it. Then you have a recovery phase. And when you scale the chart, the recovery phase is the other half. I mean, when you look at it, it's common if it took so long, a certain amount of time to go up, it's going to take a certain amount of time to go down. And these are all percentages. So it doesn't matter if it's a small population or a large population, percentages behave the same way. So we could kind of call the recovery the other half. And what's happening is during the growth, each person that gets the illness is giving it to more than one person. After the peak, each person that gets the illness is giving it to less than one person until it goes away. Now, sometimes it goes down in a little slope like this, and then sometimes it goes down for a while and then just drops to zero, like someone just slapped a paper airplane out of the sky. And the reason for that actually has some background in it, is that there's a certain amount where there's a tail end of an outbreak where the last people are having it, or a few people having it, and there comes a point where everyone who has it knows they have it and stays away from other people. And it doesn't drop like a half-life at that point. It will it could be a certain number of people, but if they all know they have it and they all isolate, then you're going to just see a drop. The next day, other people aren't getting it. So that's the shape of this thing and the size of it. Now, there's a few math constants here that have been just shown throughout a lot of these types of contagious things. One of the math constants is while a new virus is freely flowing through a region, the number of people affected by it doubles every 3 days. So I've pulled up a chart here. You can look at a chart like this and it'll tell you if a virus is freely flowing or if it's been influenced by social distancing or stay-at-home measures. So let's look at some example numbers. I'm not trying to explain this whole chart, but it's just a handy way to look at totals for a region. You can see in the gray box here total confirmed cases and a date. So that's what I'm using here. Let's pick a number that's easy to double. Here's one, 209. So double of 209, it would be 418. So if the virus is freely flowing through a population, 3 days later, we will have 418. So that was the March 24th. Let's add 3 days. March 27th, 414. So you can tell that this part of the chart has not been affected by distancing measures or something like that. Let's take this 414 and double that. Okay, that'd be 828. So from March 27th, we'll add 3 days over to the 30th here. We would expect 828, but the number is 606. Now that tells us that this section of the chart, or these days, have been influenced by social distancing or stay-at-home measures, that the virus is not being allowed to freely spread from people to people. Let's look at Louisiana as an example. Let's find a number easy to double, 392. All right, so 392, double that would be, that's about 400, would be just a hair under 800 we would expect. Let's see, March 19th, add 2 days. Or 3 days, doubles every 3 days. So we're expecting a number just under 800. And this is a number that is over 800, all right? So that tells me that these days of this chart of Louisiana has been influenced by something akin to the opposite of stay at home, that it's been unusually gathering of people, is what we can read from comparing total cases from 1 day to 3 days before. Let's continue. Let's find another number that we can double. 2,300. So double that would be 2,600. Or excuse me, 4,600. This is March 26th. Let's add 3 days. March 29th. We were expecting 4,600. This is less than that. So these date range of this data has been influenced by social measures that are slowing the spread. So that's an example of how you can take what seemingly looks like just a bunch of just data thrown at you every day of totals and actually understand that results are measurable of distancing efforts. The other constant here is there's a 2-week incubation period for the coronavirus. So when someone contracts the virus, they are contagious for 2 weeks. Now, as we get more data, it's technically about 12 days, but we'll call it 2 weeks. So they're contagious for that period of time before they really know that they're like, I am unwell. Now, this chart has a great way of pointing out some of the interesting ramifications of a 2-week incubation period. It is what makes this invisible, that we call it. So you can look at, like, for example, the peak here on January 24th, and there's a peak here on the 5th. That's, 12, 13 days, something like that. So it's a confirmation. It's an example of the 2-week incubation period that we know. But let's combine these two numbers that we know, a 2-week incubation period and doubling every 3 days. So here's what this means. It means that, let's say there's 10 people that are known to have this at a certain point in time. Well, that means they had it 12 days ago. Over a 12-day period, it doubles 4 times. This is kind of like, a little bit of a flashback in a TV show, to look 12 days back and then fast forward to today. So if 10 people are known to have it today, let's back up to 12 days ago. 10 people had it 10 days ago. So 3 days into the incubation period, it doubles to 20. 6 days into the incubation period, we have another doubling. That's 40. 9 days into the incubation period, it doubles to 80. And then by the time we're back to today, 12 days after the incubation period, it has doubled again to 160. So what that means is that for every one person that we know has it today, they've had it and have given it to 15 other people that we don't know about, because it's now 16. The unseen chart is 16 times bigger. In a sense there, during the unmitigated outbreak, the problem, or basically any metric you look at, is always 15 times worse than it looks during an outbreak. So that's something that is the wrong direction. That's why it spreads like lightning. The goal is definitely to get that so instead of one person giving it to 15 people, one person gives it to less than one person. So then you have a half-life. Let's walk through a timeline of this illness. The numbers here have been sourced and confirmed in various ways, and can talk about that at the end. But here's the timeline of what's going on. So a person first contracts the illness. One of the numbers we know is that of the people that get it, 1 out of 10 will seek medical care, and 9 out of 10 will handle it on their own. Now, these numbers hold pretty constant when you're dealing with big populations. These numbers can be different among different demographics, but the data we get officially from news sources does not aggregate among demographics. It tends to be general population. So we're going to just stick with general population numbers out. Okay. So if a person gets it, we know that 1 out of 10 of them will need care 2 weeks later. So that's a 2-week incubation period. So then at some point we'll have a statistic that we could monitor, which is the number of those admitted into care. That'd be something. The next statistic that's holding really constant is about, of those that seek care, about 13%, or about 1 out of 8, start to see severe symptoms within about a week and a half. Of those that start to get severe symptoms, about a week and a half later, well, they're part of this death rate, and I can't believe I'm talking about it like a math statistic, but this is a math model. So if you look at the numbers here, so 3 times 8 is 24, times 10 is 240. Of the people that get this illness, they have a 1 in 240 chance of being part of this statistic that we are all trying to avoid. Percentage wise, that tells us that this is 99.6% survivable. But when you have a population with a lot of zeros on it, that still starts to turn into some numbers. If we chart this out over a number of days, kind of like the last one we saw, of the new additions to the totals, we will see a shape. And the important thing to note here is that if we know one shape, we can know the other shapes. That's because one statistic can come from another statistic, because in a population, these things just hold statistically. And if we know those admitted to care, we can tell you roughly how many are going to show up in another statistic, maybe over here later in time, 3 weeks later. There's going to be a death rate spike that matches the shape. I put this down kind of small because that's height-wise kind of proportion, but I'm going to show it kind of full size here for a second, to really emphasize that these shapes are similar shapes, because each one is a fraction of the other that happens at a predictable distance in time from the other. So if we want to move backwards and know when someone contracted, that's like our last chart that we saw. We had a little green chart over there. We can say, like, well, at some point in the past, about 12 to 14 days earlier, we will see a chart that matches the same shape. The gray one here, this is a little bigger. I can't even draw it to scale, but it would be on top of, it would match this green one, just be 10 times as many people, because what we're seeing here is the yellow and green, they match in shape, size, and height and width completely, because the green is the people who will seek care and the yellow are the people who have, seeked care. So some things to point out with this is, we just look at these transitions here where they cross over. There's an awkward point here where social distancing efforts are working, but the news is reporting more cases showing up into a hospital. To switch back to this one, social distancing efforts, or the stay-at-home efforts, started here. In the true chart of what was going on, the efforts were effective. They were succeeding. And as people stayed at home and got kind of bored staying at home and wondering why they're still staying at home, it has been getting eliminated. This is a very good direction. But all these people sitting at home, do they see the green bars? They see the orange bars. They're sitting at home seeing higher record highs, more people today than yesterday showed up at the hospital. And so there's this awkward transition where during the time that you're doing exactly what you need to do, you're getting real data that's telling you it's constantly getting worse. That is just all I could say is an awkward transition that happens here between the real infections and the visible infections. And there's going to be another awkward transition here between the visible number of infections and the people being treated at the hospital. As that's going down, as we start to hear like beds are empty at the hospital, they're not needing to treat people, as that's going down, at the same time, we're going to be hearing we've had record, new deaths. And that's going to be very confusing. Like, well, is it because deaths was definitely a definition of it getting worse? Is it getting worse or is it getting better? And that's where you kind of need to understand the shape of an outbreak and the time differential of these two statistics. Let's see how this plays out with an example hospital in a region that has the ability to care for 50 COVID patients. Let's say that's their ability to comfortably care for people. Now, let's say 3 people show up so this is the yellow lines, people showing up. Let's say this thing's going up, and we have a total now of 3 people in the hospital. What does that mean? Well, when you walk through the math here, if there's 3 people who are in the hospital today, This is, again, it's like one of those little flashbacks from a This Is Us episode. You can go back and forth. Okay, if there's 3 people who asked for care today, there were 3 people who contracted the illness 2 weeks ago that are going to wind up asking for care. That's just kind of circular logic here. So 2 weeks ago, 3 people contracted the illness that will need care. That's the green number. Well, that means 30 people contracted the illness 12 days ago. Okay, so 30 people contracted the illness 12 days ago, and we don't have any distancing measures in place. This thing will spread at an exponential rate, and the problem is actually 15 times worse than we think it is. So 30 people times 16 is 480. So by the time we go back here and know that the people had it, and then we come back to today, we have 480 people in the population right now that are carrying the illness, even though there's 3 in the hospital. So this is an immense multiplier here, right? I mean, this is like, it's now 150 times worse than you think it is. When people start showing up in the hospital. So this is the model that the scientists used, and this is the model that tells cities to shut down well before anyone thinks it's important for them to shut down. Like, why would we shut down? So if a hospital can handle 50 people comfortably, and 480 people right now are in the population that have it, well, that means that 12 days from now, a tenth of those 480 people, that's 48, 12 days from now, 48 people are going to show up at the hospital. And they don't know, when this outbreak first happens, you don't know what the peak is. So it's something that you can't really pretend to guess. It could be like, maybe, this is what's going to happen, kind of thing. That's the model that takes a 100,000 person city and shuts down the city because a second person showed up at the hospital. Seems crazy, but it's what you got to do, because if a third person shows up at the hospital, that means 48 people are going to come in 12 days and you'll be at capacity. So really, to have some room for error, you should shut down the city as soon as you can when there's 2 people in the hospital. If there's 3 people in the hospital and you wait 3 days before you shut down, do a stay-at-home order, there's now not 48 people coming in 2 weeks. There's twice that, because every 3 days it doubles. So now there's 100 people coming in 2 weeks plus 3 days when you can only support 50. So that's why even waiting a couple days for shutting down a city is kind of a big thing. And hope that explains kind of some of the like, why are we shutting down so soon? Now, this exponential model holds true until you know where the top is. Okay, so once some time goes by and you start seeing the top on a chart. So let's say you have, new people coming to a hospital. Here's the top. Well, now it changes drastically. It erases it's 15 times worse than you think it is. It erases it's 150 times worse than you think it is. We now know that if this direction is decreasing, we can go back 2 weeks and we know that this invisible shadow here in the green is also decreasing. That means it's no longer rising. Okay, so it changes it from it being worse than we think it is to it actually being some fraction better than we think it is. And when you replay out the last 2 weeks, it makes a huge difference as to what's been going on in the last 2 weeks. So let's replay that out. We know where the peak is on the green shape. That's kind of, 2 weeks prior. So we can know that. Once we know that we can take the length of time from the beginning of the green shape to the peak and add that and get some rough idea of when this will be eradicated. Some rough idea of when no new person is infected by this. And the good news is that clock started ticking 2 weeks ago. So once a peak is seen, you go from being thinking of the worst to thinking of the best. Let's pull in an example of this. So we have our local hospital here put out an announcement that they have 65 confirmed cases in our county, and that we should be aware that means there are 650 people out there that are running around with this virus. And they used some very emotional terminology of we're hunkering down in a tent and a storm is going on. Let's unpack that a little bit. Okay, so they used the 10 times multiplier. Of those that were admitted to care, 10 times as many people have it. So that's another confirmation of this number. But it's an odd one that 10 times, the 10 times of them would be out there, because if 65 people are admitted into care, they're not out in the population. And a certain amount remaining of those probably are suspect, because they've been around the guys who are confirmed, probably suspect they are, and they're not out in the population. So honestly, if there were 65 people in care today, it would really fall somewhere around below 500-ish of people that are out there today spreading the illness. But that even doesn't line up with our math model, because we just finished explaining how if there were 3 people in the hospital, there's 480 people out there spreading it. That's if the logic was on the growing side. If there were 65 people in the hospital, and if we were on the losing side of this thing during the initial outbreak, there would be 4 or 5 digits of people out in the population spreading it. So it's hard to find where to fit these numbers into the actual math model. The other number that's curious is the number 65 confirmed cases. Well, the first confirmed case, which would be the beginning of this yellow shape, the first confirmed case was on March 1st. Now, if someone was sick enough on March 1st to receive a COVID test and be confirmed that it's a case, that was 7 weeks ago. Do you think that person is still contagious and running around today, 7 weeks later? No, this is our math model here. After the yellow line, we're looking at about 3 weeks, and this thing resolves. That first person that was counted in the 65, he is cuddly clean. So there's a number of people, some light fraction of that 65, that don't even relate. So I'm struggling fitting that announcement's numbers into the actual charts here. But let's look at another part of the announcement. It said that on April 5th, the hospital had its peak residence of COVID patients. Okay. Now, peak residence, that's the most number of people filling beds. That's not the people who have seeked care or become to seek care. So forgive a little geometry here, but let's extrapolate a little. If the average hospital stay is 2 weeks and the peak amount of people staying in a hospital was on April 5th, what that means in math terms is that the 2 weeks prior to April 5th generated an area of this chart, not a height, but an area that is the max area that 2 weeks could give you in this chart. Don't mean to lose you there, but what it means is the place that would be the max area would be centered around the peak. So if we can assume the average hospital stay is 2 weeks, it means the peak is probably about a week before April 5th. Now that's a little bit of, finger in the wind, holding finger in the wind math there. All that to say, I'm going to round it down just a couple days. April 5th, let's round it to April 1st. We'll call it the beginning of April. So we now know that the peak of the yellow shape is the beginning of April. We know that the beginning tail of this yellow shape is the beginning of March. We can extrapolate where the peak of the green is and where the beginning of the green is. It will be minus 2 weeks. So if this is the beginning of April, this is the middle of March. If this is the beginning of March, this is the middle of February. So the charts that we all desperately want to know, what's really happening, what is really going on, we have some solid information about it right now. We know that what's really going on is the first person that needed medical care 2 weeks later contracted it in the middle of February. And the peak of this running its course through this population was reached in the middle of March. Now, I'm an engineer, so I'll be really accurate here. If one person in the middle of February needed care 2 weeks later, then it probably means that 10 people had it in the middle of February. If you jump from the green to the gray shape here, it's going to tell you that the middle of February, the gray shape was at 10. So that probably, if you back that up a little bit more, you could pinpoint that the first person strolled into town with COVID in probably the first week of February. And it grew to the point where someone got it that wound up needing care. We have a lot of information. We know the length of the first half of the green shape is 1 month, middle of February to the peak, the middle of March. So if you add another month to that, this would be the eradication part of the phase. 1 month after the middle of March would be the middle of April, which puts the tail end of the green shape around the middle of April. Now, again, as an engineer, that means the gray one might go a little bit longer. Maybe we'll get back to that. That means what's really happening, what's really going on of people contracting COVID in our county ended in the past. It's something that's over. And if we go back to the yellow chart here, so the beginning of April is when it peaked. You add a month to that. We would expect to get new patients at the hospital as late as the beginning of May, even though people contracting this illness has coming to an end in the middle of April. So we would expect this to wrap up by the end of April. Now there is this next red peak that's going to have its own play out the first 3 weeks of May. And that's going to be a very long play out there. But the public service announcements here are saying that our surge is coming in May. I have to say, the math doesn't show that. Our eradication is coming in early May. Okay, we're mid-April. Let's look at another stat that was announced yesterday. Okay, the hospital announced that as of yesterday, April 21st, there were no patients under care in the hospital. No patients under care. That is a significant stat, okay? That happened early. I mean, if that holds true in the next couple of days here, that's happening earlier than May 1st, it's happening earlier than where we're expecting this tail to be. It means we're out here, right? Where there's no more patients coming in. So what's happening there? Well, we talked earlier how the last tail of the recovery sometimes just gets slapped out of the sky and dropped to zero a little earlier than predicted. What does that mean? What can we learn from this? So the no patients are under care at the hospital. That probably means for a few days now there's been no new patients. So we could rewind that a little bit here. Because if there were any new patients in the last couple of days, there would be someone under care. So a few days ago, there was no new patients seeking medical care at the tail end of this yellow shape. What that means is 2 weeks prior, from a few days ago, there was no one who contracted the illness who wound up needing medical care. So that means this green shape came to an end a little more than 2 weeks ago from today. The gray shape, now Now, no one contracted the illness a little more than 2 weeks ago that needed medical care. Now, technically, statistically, about 10 people could contract the illness in order for one to need medical care. So, this is what we can tell you now that no one's showing up at the hospital. We can tell you that 2 weeks ago, there were less than 10 people carrying COVID in our county. That would be the tail end of the gray shape. So, in a time where they just announced that there are 650 people running around spreading COVID in our county, the math model can tell you that a little over 2 weeks ago, there were less than 10 people running around spreading COVID in our county. So, that is about where the math stops, and you would have to extrapolate on your own what that means. What were those less than 10 people doing these last 2 weeks while we were under a stay-at-home order and there was nowhere to go to do anything? I think they were staying at home, right? I mean, this is a little bit of just follow through. I mean, so 10 people had it 2 weeks ago. I think they've hunkered down. They haven't done anything that complicated or been many places. And I think they all know they're sick by now, because in 2 weeks you'll know that you're sick. So the very day that a medical facility says we are not receiving new patients is the very day that everyone who has the illness knows they have the illness. Now, it may have spread to a couple more people. Those 10 people could have someone they sat on the couch with a lot that week, or someone they drove around in a car with, or or something. Maybe a household member, a child or wife or something. So that it's not to say that there would be no new cases contracted. There could be a little tail of this gray line, but the question is at what point do we know that any new cases, we know who they are, right? So the less than 10 people that had it 2 weeks ago, they know they have it. They know where they've been the whole last 2 weeks. They can let everyone know around them that they should be concerned. And those people can maybe let some people around them know that they could be concerned. Well, so anyway, as soon as patients stop showing up at a hospital, you follow through the math model on this, and it means we should start asking ourselves, when can we stop quarantining the general population? Because the enemy is no longer invisible. It's not an invisible enemy anymore. We know where it is. So we can simply quarantine the people that have it or have been around people that have had it. All that to say, am I participating in any, marches on we need to reopen? No, I mean, we could continue to stay at home another week. I mean, that's called room for error, right? But I got to say, we're looking at a week. There's no sense in continuing in our county a stay at home into May. That's just what the math is showing. Let's look at the red shape here. I'll make it kind of big again so we can point at it. We haven't really talked about this much. This is great for confirmation. After we've seen the peak in the yellow curve, or let's say the end of the yellow curve, a couple weeks later we can see a peak in the death rate curve and an end to the death rate curve as a great confirmation. It would show up at a specific distance or interval as the illness progresses among the existing people. So another usefulness of it is, let's say someone just really doesn't trust the data for the yellow curve. Those admitted into care. I don't trust they're telling me the right things, or maybe we don't have the right testing, or that kind of like maybe if we had more information or something. It's an argument. We can look at that. The death rate definitely stands as a unique measurement because, well, for one thing, it has a specific day that it happens. And when we're trying to look for a peak, being able to log things on the correct day is very helpful to statistics. So let's look at how we get these numbers if we only looked at this uniquely reported death rate. We're going to go back to this chart here and take a look at Louisiana. I'm going to have to scoot it over, it looks like, so you can see a little more. Louisiana here reached a peak of confirmed cases on April 7th. So let's switch over to reported deaths here. The peak here, I'm looking at the bottom right number, 461, 458. There it is. So the peak here is on April 18th. All right, so the peaks match up, and they apparently are 11 days apart between April 7th and April 18th. 11 days, where have we seen a number like that? That's a week and a half. A week and a half. So if we are starting backwards, or at least a further out here, looking at the peak of the death rate chart, that tells us that the confirmed cases chart seems to be about a week and a half. Now, if we think about this, this might make sense, right? Those turning severe, that'd be about midway through care here. Could it be possible that people were only tested once they turned severe in symptoms? I think I may have seen a news article about that, right? Conserving tests and waiting till they're severe. So if that was the case, then technically the numbers we're getting of, say, confirmed cases isn't exactly matching up with the yellow shape of those admitted into care. It could be that confirmed cases match up a little further into the process here, into the orange line. I don't have an orange shape right here, but it would be right in the middle between the yellow and the red. So if the confirmed case is given as that, you can simply just do the math. If you take the death rate peak and want to know what really happened, the green curve is what really happened when people were infected and when it was spreading. You take that peak and subtract 5 weeks instead of 2 weeks, and you're going to get an idea of when it was really happening. So let's look at the data we were given from my county here. What if in my county we had, I guess, what you would call a testing delay? What if the 65 people that were confirmed cases that peaked on April 5th was actually the orange shape? Does that change our interest in when to open? What does that mean? What does a testing delay mean? Well, the date we took was the hospital saying it had its peak of patients. So if that happened on April 5th, about a half a week into April, and if that was actually the peak of the orange shape, we would go 3.5 weeks back to get the peak of the green. 3.5 weeks back. We thought the green was mid-March. Maybe it was 1 week into March. That is only a more favorable argument, in a sense, for this being eradicated. On the front end of the curve, when things are exploding at an exponential rate, a testing delay is very scary, and it increases the problem exponentially. On the back end of the curve, if we had a testing delay, it only increases the amount of time that it's had to recover, that the real curve has had to recover. If there's a testing delay, it pushes the green curve back further. So those less than 10 people that were unknown people in my county, roaming around 2 weeks ago, maybe that was 3 weeks ago that less than 10 people had it. Anyway, that's what a testing delay can show. It's a good example of knowing where numbers belong. If you receive numbers or you see them in the news, where do they really fit? So another example of a number that was mentioned publicly by the people this week was that less than 1% of the population in our county has been exposed to COVID. Now, exposed would be the gray number, right? And they used 69 as the confirmed cases. So if 69 was the yellow area, that would mean 690 people have been exposed to it in our county. 1% of our county is 2,000 people. And that statistic could be absolutely right. 690 is less than 2,000. If the number of confirmed cases is actually the orange line due to conserving of tests, then it would actually be 8 times more. So not 690 people exposed, but what would that be? It'd be over 5,000 somewhere. So 5,500 or something. So it's good to know where numbers come from. If you're taking a number like 69 and wanting to know what percent of the population, it would be just as reasonable to say that 2% or 2.5% of our county's population has already been exposed. So that's the numbers. All right, so let's look at some terms that have been floating around and part of household discussion this last month. All right, these are terms, and I've kind of lined them up with how these things try to slow the process. We're trying to get from no one having, slow the process of general public to not dying. So obviously, vaccine would be very at the top. This is where it comes in. It happens before you get the illness. Vaccine is over a year out. I'm not going to complain about that. I think vaccines are a miracle to begin with, and they're very complicated. So I salute that, and let's just get it right the first time. So masks, we've talked about that in the news. This is the stage where masks help. Okay, this is prevents people from getting it from the very moment that they get it. It's not what you think, though. Masks don't help you because you're breathing clean air. You get the disease from touching a shared surface and then touching your face. So what masks do is they keep you from touching your face. They protect you from yourself. If you happen to be one of the people carrying it and not knowing it, masks are actually protecting everyone else. So masks protect you from yourself and everyone else from yourself. But this is the stage where it helps. If we continue on down, social distancing helps with this ugly +2 weeks stage. This is what makes it so we get rid of the invisibleness of the enemy. And if we can get people to sit still for 2 weeks, then we know who has it and who doesn't. Testing, that shows up in this admitted to care. So man, my wife got admitted to care. Should I be concerned? Should my kids be concerned? Should, the people I had over for dinner last week, should they be concerned? That's something that's kind of handy there. But I got to say, there are many kinds of tests, and there is one kind of test that is completely 100% accurate, that is completely free, and is given to everybody every day. It's called Wait 2 weeks, and you'll find out. So this is a free test. It's given to everybody every day. It's done across the entire population. It just is a little bit slow. It takes 2 weeks to get your results. Okay, but there is lots of testing going on when you consider waiting for the incubation period. And all of this math model is just taking into account the incubation period and when people find out and when people seek care. So, that's that. Therapeutic. So this is the stage here where we want to reduce the number of times that symptoms turn severe. This is a big deal, So the 13% rate of cases turning severe is holding pretty steady when there's no care being given. And unfortunately, there's not really, it is very steady right now because there is not a care in a sense. I mean, here's a bed, we will take your temperature readings or whatever. But doctors are not legally able to even discuss options with you that have not been approved by the American Medical Association. So the only things approved by the American Medical Association is oxygen and ventilators. So there's a standard of care that's very repeatable and predictable right now, but that's something that can change. And there are very promising things that we look forward to. This is something to look forward to in the news, maybe around summertime or something. There are therapeutics that take this 1 out of 8 number and make it 1 out of 88 people get severe symptoms. I mean, there's a lot of promise, and the right people are working on the science and math on that. That's a different science and industry. But when something like this comes together, and we don't have to wait a year for it, you can see how it changed the entire feeling of this entire process. When only 1 out of 88 people turn severe, the survivability rate gets a lot more nines in it. And that's the time that your kids can have birthday parties again, and people might be traveling again, and just some life being what we think. Ventilator, that shows up in this last severe stage. The only thing to comment there is it doesn't actually treat the illness. It's life support. It's not doing anything to reverse the situation. So that is some of the vocabulary there. I want to close out with I know a lot of people, this whole time you're thinking in your head, dude, everything you said does not match up with what I hear. Everything you said is not what I know. So who the hell are you, and why are you even talking to me? I know that's going to be the first question asked. I know that's going to be the bulk of the questions asked. So I'm just going to take just a quick moment for biography here. This is an article. I have the citations up here. If you Google this or get to this point, you can click on this link. There's the original author is this Thomas Payo, and I'll just leave a nice little biography of him scrolled into view. Myself, people that know me know that I'm kind of a geek, and what people that know me may not know is I have a pretty rockin' SAT score for the math portion, and I can go head to head on people on that one. What else? I'm in a career that I have to draw conclusions out of very sparse and seemingly conflicting information. It's very common for me. I have been in and out of the ER a number of times in the last couple years, and twice an ER a staff member of the hospital has asked me if I'm a doctor because I'm asking such specific and intricate questions. So I don't know. That's me. I'm not a doctor, but I think like one. I'll show the other web address here. This one, just click on it. So that's this chart. If this was at all useful to you, repost to your social media. I appreciate it. I kind of blew a day of work producing this video for you. If this was at all useful, share it, let people know. I did it for the reason that many people would like to be able to make sense of the information that's coming in right now. And as more and more charts across our country start showing up with tops in them, it'd be great for people to know what that means and to know that we're looking at a matter of weeks, not a matter of months in this war. And maybe there will be another outbreak in a region. Maybe this summer or this fall or something. Hopefully by then, therapeutics have been approved, or there's some new treatment methods. And you can know that when maybe a little aftershock happens later in the year or something, know that there is an attack plan that is able to eradicate this enemy. So thanks for watching, guys.